All right, well, we're ready for a review. And as I told you, that I consider these learning experiences. Some people say, well, it's just easy, you just give us answers. But I'm hoping that you're learning these answers. All right? That's our intent. So, first slide, please. We'll wait till, can you see that? No. Can we darken something a little bit but still keep light for me? Because I can't read with that. I can't read and they can't read. Can I get something? How about that? That looks pretty good. Are you fine? No? Just a little bit more in focus. We'll tell you when it's a focus. Whoops, you went by it. Went by it. A little more, just, there you go. That's good. That's beautiful. Thank you. All right. If the purpose of the tracheotomy is to allow for air into the lung as quickly as possible, the incision should be made in the larynx? Answer. You've got to answer. No? In the bronchi? In the alveoli? Between the C-shaped cartilage rings? Yes, okay. Next one. What kind of cells are these? Come on, what kind of cells? Neurons, right? I want you to speak or we don't move, all right? We remember that, because you've got to be learning and listening and thinking and not just copying to pass a test. We're trying to give you information that will be beneficial in your future, all right? So, what do we call the substance that's in here? Nasal. What do we call this? Axon. Axon what? Axon hillock. Good for you. Next one. Now we have an electrical impulse coming down a nerve fiber as it approaches the presynaptic terminal. We have some calcium out here. And we have what in here? Pardon? Neuromodulators? We have neuropeptides, we have neuromodulators, we have neurotransmitters, we have all sorts of things, don't we? And we need to get the vesicle down to where? What do we call this? Pardon? This whole thing's a presynaptic terminal. They're already here. To the presynaptic membrane here, right? So they're going to fuse with it. So we have calcium coming in and acting with what? Calmodulin. Remember calmodulin? No. But it has to do that to set up a what? So that these will migrate down to the terminal. A substructure, right. Otherwise they're free-floating here. They need a substructure to get down to the terminal. The next one. What have we got here? Lungs, good. Now, we have membranes on these lungs. What is the membrane that's adherent to the lung? Visceral pleura. What is the membrane which is just a few millimeters away from the visceral pleura? Parietal pleura. And what is between the two? Pleural, right? Pleural fluid. And what forms that pleural fluid? The pleura, sure. Next one. What are these? Neurons. And what is this particular neuron called? Sure, pseudo-unipolar. I want more of you to speak up. You're just waiting for the ones in the front to answer. But I want the rest of you to say it too. So it's pseudo-unipolar, right? Now, does this process have myelin? Yes. Does this process have myelin? Yes. Good for you. Next one. What is the black substance on this fiber? And are we in the central nervous system or the peripheral nervous system? How do you know? Pardon? I said, how do you know you're in the peripheral nervous system by looking at this neuron? Pardon? The muscle. Good for you. And what is forming this myelin then? Schwann cells. And what is a Schwann cell? It's a glial cell. Good for you. And it's actually a glial cell from neural crest cells. I didn't have time to talk about those, but you should know the difference between neural crest cells and neural tube cells. And a Schwann cell is from the neural crest. The next one, what is it? What is? No, but you're close. What does oligo mean? Few. So when you look at this cell, what do you see? Few what? No, glial cells don't have dendrites. What do glial cells have? If you didn't know, if you weren't even in class, what would you call these? Pardon? Processes or branches, right? So they have few branches. Now, multiple sclerosis is an autoimmune disease, and the myelin sheath slowly disappears. Myelin in the CNS then is formed by what? These cells. And can this fiber then myelinate more than one? Yes. Process from a neuron. Next slide. Where are we? Are we forebrain, midbrain, or hindbrain? Forebrain, good for you. How do you know forebrain? What are these large structures here? Basal ganglia. Here you are in the cerebral hemispheres, and in this slide it shows the basal ganglia so large and clear. Does anybody know what the structure going through the basal ganglia represents? The internal capsule. Fantastic. All right, now, what part of your neural tube, when you have the 5 divisions, does this section come from? Prosencephalon, but divide the prosencephalon. What part of the telencephalon. Right, good for you. Next one. What is this? What is it? Well, is it a cell? Yes. All right, start big. What kind of a cell? It's a neuron, sure. 9/10 of your tests will be on the nervous system, right? Because that's what this segment is. So you're pretty safe in guessing that. Now, the cellular organelle that continuously renews protein in the membranes and the cytoplasm of a neuron is called what? Rough endoplasmic reticulum. But what do we call it in a nerve cell? Nissl substance, right? So you see the Nissl substance here. How much CSF is formed per day? I don't hear it yet. 700 cc's. Good for you. Do you feel it? Next one. What is this big thing? It's a cell, but what kind of cell? No. No. It's a glial cell, you're right with that, but what kind of glial cell? What glial cell has such a multiple function as an astrocyte? What do we call the junction between two Schwann cells? A node of Ranvier. We have a process over here. What do we call a junction between two nerve cells? A synapse, right, and you have a process there, don't you? You have a pendymal lining. We have a process there. We have a peel lining out here. We have a process here. Here's a blood vessel. We have a process here. Here's the soma. We have a process. You see how ubiquitous are these processes? So in general, if somebody, you want to just summarize all this, and they say, well, what do glial cells do? What would you say as just a summary? Support? Break down that support. Metabolic and structural support. So if somebody asks you, what's a glial cell? It's the structural and metabolic support cell for the nerve cell. Next one. Here we have a group of cells, of nerve cells. You haven't seen this slide before. These are all little support glial cells. Sometimes we've talked about satellite cells. These would be satellite cells that are somehow interacting with the nerve cell. But when we find a group of them outside the CNS, what do we call the group of neurons outside the CNS? Ganglia. Good for you. Next one. Next one, please. Now, what do we have here? Pardon? Presynaptic terminal. Sure, you can see the myelin leaves off before the terminal comes down. And what do we call the projection? Dendritic spines. Sure, it's just an artist's rendition of a dendritic spine, but you can see it here with the presynaptic terminal, the postsynaptic terminal. These are dendritic spines. So if we have an axon coming into a dendritic spine on a dendrite, what kind of synapse do we call it? Axodendritic, sure. What other kind of synapses can you have? Can we have an axon coming in and synapsing with this axon? Sure, you have axoaxonic. Do you have one coming in and synapsing with the soma? Sure. So you have axosomatic, you have axodendritic, and you have axoaxonic. There's one more. Dendrodendritic. Those are very rare, but they're finding many more of them than we ever thought before. Next slide. All right. Can anybody tell me where we are? No, but you're close. What's the other cortex in the brain? Cerebral cortex. Right. So we have large, these are pyramidal cells, but with a different stain than you're used to. So it depends on the stain how you can identify them. So most nerve cells in the CNS are what? if you have motor neurons and you have sensory neurons, interneurons. So the question is, are these cells in the cerebral cortex? Which category? The question is, what category are these big cells in the cerebral cortex? Do they innervate muscle? Interneuron, sure. It's a good lesson for you. They're in the motor cortex because they influence motor function, but they only do so through an anterior horn cell, which is down in the cord, or a cranial nerve nucleus, which is motor. All right? So you have to learn what are interneurons, and these big cells are. Next slide, please. It's a little bit dim, but I think you can see it. There's an area up here between the gray matter and the edge of the spinal cord. What do we call it? Lissauer's fasciculus, sure. And Lissauer's fasciculus is associated with what sensory modality? Pain and temperature, good. Next one. What does this represent? Pardon? The ventricles of your brain. Can you see your brain with ventricles like this? Can you picture? This is the anterior, here's your nose, here's the back of your head, and you have these channels in here. Now, we've learned them as we've gone along, but you've never seen them collectively like this. So these are the lateral ventricles. They're in the hemispheres. Posterior, inferior, body, and anterior. They're in the hemispheres. From the hemispheres, the CSF, or cerebral spinal fluid, flows into the ventricle between the thalami and hypothalamus. That you have had. What is the ventricle between the hypothalamus and the thalamus? Third. Hey, good for you. And from the third, the cerebral spinal fluid flows down to a very thin ventricle that will run down through the midbrain. What do we call it? Aqueduct. See the aqueduct coming down? And we get then to the area of the hindbrain. And what ventricle do we have there? Fourth ventricle. If nothing else, you can read it. So you see the flow of CSF is coming in to the ventricles and flowing down from the lateral ventricles through the interventricular foramen to the third ventricle, to the aqueduct, and to the fourth ventricle. And the fourth ventricle, it goes outside the brain and flows around. Remember, we said CSF went around and would flow into this big venous sinus that's up here. What's it flowing into? Superior what? The sinus, right. Your superior sagittal sinus, or if you like, the longitudinal, superior longitudinal sinus. So CSF that's forming in the ventricles will flow out around. In what space does it flow to get up to the superior longitudinal sinus? The arachnoid space. Good for you. Right, so if I were to ask the question, cerebral spinal fluid in the third ventricle flows into what? Into the aqueduct, sure. But that's where you're learning, because we didn't have time for that, and it's terribly important. Now, next one. Whoops. Sabotage. You don't get any more. wait, see, they're working hard. There they go. So this picture I know I've shown you because I told you, did you go home that night and look in the back of your mouth and try to picture your uvula, your spinal, your vertebra, your spinal cord, and come back? And what we want to do, what is this? Medulla. What's this? What's this? Midbrain. So what is this? Now the question is, the third neuron in a sensory pathway from the cord is found where? Thalamus, right. That's why I wanted you to see where the thalamus is, because you had your first nerve in a sensory pathway is where? In your dorsal root ganglia. And the second nerve, dorsal horn, it's also in another pathway in the medulla. So it can either be dorsal horn or medulla. I just gave you the dorsal horn. You're learning more now to fill in. And then the third neuron is always where? Thalamus. But I wanted you to see how the pain pathway is coming up from periphery, dorsal root ganglia, into cord, up, and then to the thalamus. And from the thalamus, where does it go? Post-central gyrus, right. Okay, next one. What sensory nerve will be supplying these teeth? Five. Good for you. Are you going into dentistry? No, because you know you'll block a mandibular branch for your lower jaw, right? But it's the fifth nerve is sensory here. We said sensory to the oral cavity, sensory to what else? Nasal, and what else? The eye, the cornea. Sure, you get a speck of dust in your cornea. That's all five. But general sensory to the face, for the skin, pinch your cheek. That's fifth nerve. Now, next one. What part of the spinal cord are we at? You haven't. Thoracic. How do you know? Little lateral horns and very thin horns, because so little is coming in from the chest. We don't have much muscle there. But you have lots of white matter coming up from the legs and going down to the legs, and the same, lots of white matter in the thoracic cord, very thin, small horns, but also a lateral horn. Now, what tract do we have over here? Pardon? Spinal thalamic, but is it left spinal thalamic? Lateral. Left lateral spinal thalamic, right? You have to be correct. Now my question is, if this tract is damaged, where is the lack of pain and temperature sensation found? I'm blocking. I've cut my cord here. This is my lateral spinal thalamic up at, I'll give you this would be, let's say, T2. This is at thoracic 2. And I've cut my spinal thalamic tract here. Where am I going to find lack of pain and temperature? Be specific. The right foot's included, yes, but a lot more than the right foot, right? What level did I say I was at? T2. Be specific where you're going to find this. How did these fibers get here? Do you want to follow them up where they began? These are pain and temperature. These are sensory. These are going up, right? Right? You got to think. It's below, of course, but you have to be specific. You're more than a junior high school student here. You've been given the pathway. You could be much more general. If this is T2, 3 and 4, yes, below 3 and 4, but on which side? The right side, right? No, you get these questions across the bay, they'll fire at you, and you have to know exactly whether it's right side, left side, not just below, right? So we had the pain pathway started out here, dorsal root ganglia, came in, but it came up 2 or 3 segments. So it's got to be below right 3 and 4, because this was at T2. So you've lost sensation below right T3 and 4. Now, conscious proprioception is coming up to the cortex too, the cerebral cortex. Is it coming up out here in the lateral funiculus, conscious proprioception, yes or no? No. Is it coming up in the anterior funiculus? No. Okay, what's left? What do you call it? Posterior what? Funiculus. Say it. You didn't say it. Say it. Posterior funiculus. I can see when you're talking. I can hear too. All right, so the question was conscious proprioception. You know, does anybody in class not know where his feet are? You see them down there, but you don't move them, right? That's your conscious proprioception. We'll learn when you get advanced neurology what unconscious proprioception's doing. Let's have the next one, please. Here we have our cerebral hemispheres. What do we call this part? 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 Pardon? What do we call this part? Now, give me some functions of this part. Planning, working memory, judgment. What was that? Sequencing, initiative. How about astereognosis? Is astereognosis here? Where is angular gyrus? Is it here? No, it's not. What's that? What's this fissure? Lateral fissure. What do we call the gyrus at the end of the lateral fissure? You're close, I can hear it. No? Supramarginal, right. So what fissure is, what sulcus is this? What is it? Good for you, I can hear you way back. And now you can see what gyrus is this. Angular gyrus. It's an unusual brain, isn't it? Because normally you'd see it a little bit up here. But this is taking it, and yet we say this is called posterior inferior parietal. And if parietal is here, this is way low. But you follow your fissures or your sulci to find out where the appropriate gyri are. Okay? Are you learning? We're trying. Thank you. New slide. What do we call the cells here? The big ones. Anterior horn cells. What do we call cells here? Posterior horn cells. Now, if I were to cut the fibers here, what would I find? What did we say was crossing in the anterior white commissure? Pain and temperature. So it's the same as would happen if we cut out here. and took out your lateral spinal thalamic, because those are the same fibers. They're just getting over into the lateral funiculus, right? What's the next one? Next one, please. Now, we have fibers that are originating up here in the motor cortex, and they're coming down. What do we call them? They can be, well, the tract. What's the tract coming down? Tract. Cortical spinal and cortical bulbar. Now I want to follow the cortical bulbar. Where are they going in general? Note in general. I want you to be more specific then. Where are they going generally specific? Why aren't they called cortical spinal? What do they go to when they go cortical spinal? What cell are they headed for when you say cortical spinal? Anterior horn cell, sure. So when you've got cortical bulbar, where are they going? Stick out your tongue. How'd you do that? You had cortical bulbar. Where'd it go? What cell? What innervates the tongue? The hypoglossal what? Cranial nerve. Where are its cell bodies? So when you have the cortical bulbar tract, it goes down to the cranial nerve motor nuclei, right? That's what I wanted you to say with all of that, right? And when you have a cortical spinal tract, it goes down to its end tract. It will be the anterior horn cell in the spinal cord. Very clear, very simple. So now the cortical bulbar tract descends to cranial nerve 2. You have to think. What is cranial nerve 2? Optic. Is that motor or sensory? Sensory. So the question is, the cortical bulbar tract, does it go to the second cranial nerve? No. Does it go to the 7th cranial nerve? Pardon? What does the facial nerve do? Pardon? I mean, gosh, didn't we do this enough times for you? Facial expression. Now, is that sensory or motor? It's motor function. So can the cortical bulbar go to the 7th cranial nerve? Yes. See, it's more than just memory. You have to start putting facts together, right? That's the fun of this. If it was just memory, nobody would stay with it. It's a puzzle, just like you love to go play computer games. You love all these things because they're challenging. This is challenging once you get your tools to work with. Okay? New slide. Here we are. Can we focus a little bit, please? Focus, please. Whoops, went by it. There you go. Perfect, thank you for what we need. Now, we can start. Somebody said prosencephalon. What are the two main next divisions of the prosencephalon? Diencephalon and telencephalon. Now, we come down here. This is, when it's blue, it's mesencephalon. So red is going to be part of what part of the neural tube? Pardon? Where did we say the optic retina comes from? The diencephalon. So red here is the diencephalon. So will the hypothalamus come from the diencephalon? Yes, sure. Now we have the rhombencephalon separates into which two? Metencephalon and myelencephalon. And how do you remember which is first and which is second? Alphabetical order. Met, M-E-T, my, M-Y. So we have the myelencephalon then gives rise to what in your central nervous system? Your medulla, sure. Now, which of these do visceral afferent fibers innervate? These are, let's put it visceral efferent. Let's give you visceral efferent. Are they going to be motor or sensory? Motor, sure. Are they going to go to the lateral rectus eye muscle? Are they? No. Are they going to go to the external oblique eye muscle? Are they going to go to the heart? Yes, good. You're not speaking, but you can certainly shake your head, so that's great. Thank you. If I turn around and watch you. New slide. What is this? Oh, gosh. We've already given it to you once. Pardon? Well, let's back up. What is this? A neuron? And you see its huge nucleolus, its huge nucleus. And what are these? Pardon? The dark specks in the cytoplasm. Nasal substance. So if this is a neuron, do we have any Nasal here? No. So what is it? Axon hillock. We already had that, right? It's where the axon attaches to the neuron. So when you see this coming off, what's this automatically going to be? A dendrite. Very basic definition between the two. This will not have Nasal, and this will. So then what are these? Glia, sure. But what kind of matter would we call all of this, because they're nerve cells here? Is it white matter or gray matter? Gray matter. So you can see that you can find glia in gray matter. Would you find glia in white matter? Now you have to think. These are thinking ones. What can some glial do? Form myelin. And what is white matter? Myelinated fibers, sure. So you work it out. You do a little thinking. You didn't just memorize that in your notes. So we can have glia in gray matter, in white matter. Can we have glia in the anterior horn? What is the anterior horn? Is it gray or white? Wait a minute. Sure, it's gray. It's neuron cell bodies, that's the definition, but you can also have glial cells there. You can have glia in both gray and white. Would you have glia in arachnoid? What is arachnoid? Nope. Connective tissue. Right. So would you have glia there? Nope. All right. Now, we've already had the next one. New slide. What? Oh, beautiful. That turned out nice and clear, didn't it? Where are we? What does it represent? A peripheral nerve, right? So what would you call the connective tissue around here? Perineurium. What do you call it around a single nerve fiber? Endoneurium, right. This is all labeled. Look at all the blood vessels in there. When you study pharmacology, you'll know what drugs get through these various membranes to get to these nerves. But now, these peripheral nerves, will they have somatic afferent fibers? Do peripheral nerves have somatic afferent fibers? Of course. when we talked about the proprioception in your feet. That's coming from the soma, and they're coming to, afferent is to, efferent, exit. So, yes, they will have somatic afferent fibers. Will they have somatic efferent fibers? Sure. What do you think your anterior horn cell's putting out? That fiber's going out, it's somatic and it's efferent, right? Again, thinking. Thinking, thinking. Now, will we have fibers from pyramidal cells in a spinal nerve? No. Good for you. That's a quick one. Neurobiology is the most rapidly growing science in the world today. I want you to know it. I want you to be there. New slide. All right, this time, what are these? Dendrites, right. So, do dendrites synapse with dendrites? Yes. And obviously, with this slide, do dendrites have spines? Do they have postsynaptic terminals? Sure, you had an axodendritic synapse, right? And do dendrites convey information away from the soma? No. Good for you. Next one. What kind of cell is it? It's been our main character all morning. It's a neuron. Big nucleus. This is an active one. When you see two nucleoli, we see those frequently in our animals that have been learning. You may be developing more nuclei in your nucleoli in your nuclei. Shows a very active nerve cell. But what is a dispersed substance? It's stained differently. You've got to learn different stains. What is it? Nasal. Right. So my question is this a soma, which is part of a fiber that has been cut close to the soma? No. How do you know this is a healthy nerve cell body? Pardon? I can hear you make noise over there, but I can't understand you. I'm sorry. The nucleus is in the center. Right. Good answer. What happens to the nucleus if this is a damaged cell? It becomes eccentric. You'll see it over here at the side. What happens to the Nasal in a damaged cell? Peripheral. Why do the nuclei and the Nasal, why do they go peripherally? Swelling. Taken in fluid, the cell swells, pushes the nucleus over, and pushes the Nasal substance. What do we call the process? Pardon? I didn't hear you out there. Chromatolysis, right? Chromatolysis. That's okay if you have it mispronounced. I'd much rather you mispronounce it and try. All right, next one. What have we got here? Somebody said, what kind of slide is that? Is it a kidney slide? No, it's a heart muscle slide? No. Go through your 4 basic tissues. Is it muscle? Is it connective? It's a nerve tissue, right? Right? You only have the 4 basic ones. So learn to think big and narrow down. So sometimes when we used to grade by hand, we could give you half a point if you got the tissue right. But with scantrons, you have to have the whole thing right. So what surrounds, makes layers around the nerve fibers? What is it? No. Pardon? No. Myelin. These are the concentric rings of myelin. What is myelin? Somebody asks you, what is myelin? Fat? Okay, what fat? A lipoprotein, right. Phospholipid it is. It's a phospholipid, right? So this is myelin. Okay, next one. That's okay, it can be sideways, because my question perhaps is more interesting this way. What are 3 structural classifications of neurons? They can be unipolar, bipolar, and pseudo-unipolar, and multipolar. So what are most of these cells on this slide? Multipolar. So what's the most common type of structural nerve cell? Multipolar. Give me 2 examples where you see bipolar. Bipolar. Retina, olfactory, right? That's 2. All right, next one. All right, here we are in our nasal cavity. What do we call the openings down here? Nares, external nares. Good for you. Very correct. And what do we call these? Conch or turbinates. You'll see the term turbinates for them too. Conch or turbinates. Now my question is, does the eustachian tube open into the nasal cavity? No. Where does the eustachian tube empty into? Pardon? Nasopharynx to the middle ear, right? It has 2 openings. Now, what kind of epithelium do we have covering the nasal cavity? All right, pseudostratified, columnar ciliated, right? Epithelium with goblet cells, right. Do you have that throughout the respiratory system? No. Where are you first going to see it change as you go from the nose in the oral cavity? As you continue down, are you going to see it in the larynx? Sure. Sure, you've got to have those cilia beating for anything that's gotten down there. But there's one part of the larynx where you do not find. No, wait a second. One part of the larynx where you do not find pseudostratified columnar ciliated epithelium with goblet cells. Where? Where don't you want it in the larynx? Be specific. I gave you the vocal cords. Good for you. You don't want cilia on your vocal cords. You say silly enough things without that, right? That was a poor pun, and you're so numb you don't even laugh. All right. So will the maxillary sinus have this kind of epithelium? Of course. If you get things in there, you want to get them out. The nasal cavity, does the trachea have it? Sure. Do the alveoli have it? No. You're almost ready to nod your head yes, but you changed your mind, right? Okay, next one. Why do we have the concha or turbinates? To warm the air, to moisten the air, and to clean the air, right? Do we provide attachment for nasal muscles? No. Uh-oh, we're not finished. It's 12 o'clock. We can do it? What's today? Monday. We've got a class coming in. We'll go as fast as we can till they start, okay? But see, you didn't respond fast enough to me, so we didn't make it. All right. Tell me the bones that make up this structure. What is it first? Nasal septum. Say it fast. If you know it, shout it. Nasal septum. What bones make it up? Well, hyaline cartilage, not a bone. Gracious. Does the nasal bone participate in the nasal septum? No. Now we have a mass of lymphoid tissue up in this area. Where are we? Pharynx. What part of the pharynx? Nasopharynx. What do we call the lymphoid tissue up in the nasopharynx? Pharyngeal tonsils. What's the another name? Adenoids. What's their function? They produce lymphocytes, not just leukocytes. You have to be specific. Lymphocytes. Now, next one. What kind of cartilage is this? Hyaline. Good. Now we follow hyaline cartilage down here. Where are we here? Trachea. And then the next division off the trachea will be what? Which kind of bronchi? Primary bronchi. And then we eventually go down to terminal bronchioles. Do we have hyaline cartilage at terminal bronchioles? No. Good for you. Next one. Well, we recognize what kind of epithelium it is? Do we find this down at alveoli? No. Next one. Here we have the olfactory bulb. What feeds into the olfactory bulb from the nasal cavity? What do we call them? Olfactory nerves, sure. What do they go through to get up to the bulb? Cribriform plate, right. Same as 18. Here we go. What nerves are these? Optic nerves, right. Where is the cell body for these fibers in the optic nerve? In the retina, but where in the retina? We had 3 layers to the retina. The retina ganglia cell, sure, good for you. Now, as we come down, this was nerve 1, nerve 2. What nerve is this? It's a big one. Ocular motor. The ocular motor, does it innervate the superior oblique eye muscle? No. Is it purely sensory? Does it originate in the diencephalon? Hey, it's third nerve. Where does it originate? 2 nerves come from the same area right after you leave the diencephalon. What is it? Mesencephalon. Right, remember you just had 1 and 2 from the prosencephalon, and then we came down to the mesencephalon and we had 3 and 4. All right, is anybody trying to get in yet? Do you have the doors locked? Okay. What innervates the superior oblique eye muscle? Trochlear, good for you. All right, what innervates the frontalis? I just gave it to you. The whole class should say it. You didn't say it. 7, right? You nod your head. We just told you that. Next one. What do we have here? When does this close? I told you, I remember distinctly. I didn't give you a name for it, but I'm going to give you a name now. It's called the anterior neuropore. Neuro, P-O-R-E, anterior neuropore. What happens if it doesn't close? You don't form a brain. You have what's called anencephaly. What's an? Without. Encephaly, brain. Without a brain when it doesn't close. New slide. Are you coming in from the other class or are you coming in from back? Because if you're coming in other class, then I'll stop. Did you feel there was pressure? Okay, we'll go real fast. But you've got to answer real fast. You've got to answer correctly. Which statement is incorrect regarding the true vocal cords? They're controlled is an incorrect statement. They're controlled by the thyroid or retinoid muscles. True. They border the glottis. What's the glottis? The opening for the air to come through. Do they constrict during asthma? No. Okay. New slide. What kind of fibers are these down around the alveoli? Elastic fibers. In emphysema, the elastic fibers of the alveoli lose their elasticity. Therefore, the chest decreases in size? No. The alveoli remain contracted? No. The chest size remains large after inspiration? Yes. Did you know the man? Let's see, who did I talk? Somebody. Oh, our former chancellor. Had dinner with him the other night. He has emphysema. So when you see your professor smoking, tell him. New slide. What's this structure here? Trachea, right. The left primary bronchus supplies, say yes or no, supplies 3 lobes of the lung? Arises from the larynx? No. Is lined with simple squamous epithelium? No. This is the bronchi still. We've got to take it down. Is narrow and longer than the right primary bronchus? Yes. Okay, cancer of the lung. Next slide. I think I've got a slide for it. Yeah. Cancer of the lung occurs most frequently in the most vascular part of the lung. Why not? Where does it occur most frequently? In the bronchi. Is that vascularized? No. See, you're beginning to learn. All right. It starts most frequently in the walls of the bronchi. Next slide. And that's the sunrise in Patagonia. I want you to take off all the pressure and enjoy your neuroanatomy, okay?